what's up you guys, it's Melody, and for today's video, we will be talking about cardiac tamponade. So before we get started, here are the things that we will be talking about in this video. So first is the introduction, and then next is the definition of what is cardiac tamponade, then the pathophysiology. Next in line is the signs and symptoms, the causes, the diagnostic test that needs to be done to diagnose a patient. Lastly is the treatment. So here's a brief introduction of what is cardiac tamponade. So in our heart, there is a fibrous sac called the pericardium that surrounds the heart. This sac is made of two thin layers. Normally, a small amount of fluid is found between these two layers. The fluid prevents friction between the layers when they move as the heart beats. In some other cases, extra fluid can build up abnormally between these two layers. If too much fluid builds up, the extra fluid can make it hard for the heart to expand normally. It is because of the extra pressure, less blood enters the heart from the body, and this can reduce the amount of oxygen-rich blood going out to the body. And now let's move on to our prior discussion. So what really is cardiac tamponade? So in cardiac tamponade, there is a pericardial sac around the heart that fills with fluid or blood, causing an increase in intrapericardial pressure that compresses the heart so it can no longer fill with blood and leading to a decreased cardiac output. It means that if the heart can't get blood in, then it can't get blood out. It is because of the low cardiac output, means low oxygen put out to the body. So there are two types of having a cardiac tamponade. So first is the acute or the short term, which is life-threatening if this is not treated right away. It is because the fluid builds up around the heart too quickly. Second is the subacute or the chronic cardiac tamponade, which is another type of fluid accumulation that is characterized by the patients being more asymptomatic in the early phase. But when the pressure rises above the pericardial stretch point, they complain of dyspnea, chest discomfort, peripheral edema, fatigue or tiredness, and all symptoms attributable to increased pericardial pressure and limited cardiac output. So for the pathophysiology of cardiac tamponade, the pericardium is normally filled with an amount of fluid around 30 to 50 ml with an intrapericardial pressure that is usually about the same as the intrapleural pressure. With a sudden addition of fluid, the pericardial pressure can increase at times to the level of the right atrial and right ventricular pressures. The transmural distending pressure of the ventricle decreases and the chamber collapses, preventing appropriate clip filling of the heart from systemic venous return. The underlying pathology behind cardiac tamponade is a decrease in diastolic filling, which leads to a decreased cardiac output.
So basically, all the signs and symptoms of cardiac tamponade is the low cardiac output to the body. So we'll see classic complaints from this low oxygen and this low blood pressure, and the very first sign for low oxygen is always the restlessness, which is the earliest indication of hypoxemia or low oxygen. Restlessness is also seen as LOC or altered level of consciousness or a change in mental status. Dizziness is also a sign. Fatigue and dyspnea or shortness of breath is the difficulty of breathing. Also, tachycardia, which is the very first sign of decreased cardiac output. As the heart gets squeezed, there is a condition called Beck's triad, which is the classical signs and symptoms of cardiac tamponade. The very first one is the B, meaning big jugular veins distension or JVD. Next is the E, extreme low blood pressure or hypotension, and lastly is that you can't hear the sound because they are muffled by all the fluid around the heart. So another thing is the pulsus paradoxus, which means that the blood pressure also gets squeezed down too. It is an induced hemodynamic changes that enhance the inspiratory fall in systolic blood pressure. This exaggerated drop in systemic blood pressure during inspiration is termed pulsus paradoxus. This increase in pressure prevents the heart chambers from collapsing, and increased heart rate preserves cardiac output despite decreased stroke volume. At some point in the accumulation of fluid, which is around 250 to 300 ml, the pericardium reaches maximal distension and results in so-called pulsus paradoxus. So for example of this is the 120/80 has a normal pulse pressure of 40, but as the heart gets compressed, the numbers gets compressed too, and the pulse pressure gets narrower, so it gets to like 100/90, that's a pulse pressure of 10, and as far as the heart waves on the cardiac monitor, it's going to show an even low voltage wave in the QRS complex.
As for the causes, there are two things to consider as for its cause. The damage, which is the penetrating trauma, like stabbing, gunshot wound, and blunt force trauma, which is car accidents, falls, and cardiac surgery and heart attack. Next is the disease, like cancer, connective tissue disorder, autoimmune disease, or lupus, renal failure like urea or uremia, and hypothyroidism, which is a rare. As for the diagnostic test, there is a chest x-ray as it shows a slightly widened mediastinum and enlargement of the cardiac silhouette. Next is the ECG as it rules out other cardiac disorders. The QRS amplitudes may be reduced and electrical alternance of the P wave, QRS complex, and T wave may be present. Generalized ST segment elevation is noted in all leads. Next is the echocardiography, as this records the pericardial effusion with signs of right ventricular and atrial compression, and to visualize the heart structure and function using a non-invasive imaging test. Another option is a thoracic CT scan to look for fluid accumulation to the chest or the changes to the heart, or a magnetic resonance angiogram to see how blood is flowing through the heart. So cardiac tamponade requires hospitalization. The goal of treatment for cardiac tamponade is to relieve intrapericardial pressure and cardiac compression by removing the accumulated bladder fluid. It is to pump out more oxygen to the body and to increase the cardiac output, draining the heart sac called cardiosynthesis, a needle aspiration of the pericardial cavity in which the doctor will do surgical creation of an opening, commonly called a pericardial window, insertion of a drain into the pericardial sac to drain the effusion. This is the implantation of a pericardio-peritoneal shunt to relieve cancer patient whose disease is causing the fluid accumulation, and pericardiectomy to remove the pericardium as a last resort. And having said all of that, that was a brief explanation of what is cardiac tamponade really all about. And it now ends my presentation. Once again, I'm Adlao from NGV.